Um, as was said, my name is Caitlin Schubert, and I'm going to talk about our Connected and Online program today. So, see the slide. So just to everyone knows what the agenda will look like, we're going to talk about the timeline, program overview and goals, the equipment that we're offering, um, application details, and then I really want to make sure that folks have time to ask questions at the end. So this is where we're at with the timeline. Um, we have two additional technical assistance info sessions scheduled. One is for Thursday the 30th, and another is November 4th. That's not included on this timeline. We just added those this afternoon. So if you attend this session, you're interested in learning more about the program and needing some additional help, we will have those available. We unfortunately will just have those in English or Spanish, but if you reach out to Eugenia and have additional needs, she can pass those along to me, and I want to make sure that that's not a barrier for folks to apply. Our early application deadline is Friday, October 30th, and then our normal application will close on Friday, November 7th. Both of those will close at 5 p.m. We anticipate award notifications going out sometime in late November or early December. The early application deadline will allow folks an opportunity to get feedback and cure any deficiencies on their application. So if you attend the session, you're a little bit unsure, we'll be able to provide a little bit more feedback on that. Applications submitted after that date, it might be a little bit harder for us to give you that type of feedback and that time to cure. So just something to be mindful of. And we'll talk a little bit more about the application structure towards the end to give folks an understanding. So what is the Connected and Online program? You'll also hear that referred to CNO. And so the Connected and Online program is a just over $23 million program. It's funded through our Capital Projects Fund, which is through U.S. Department of Treasury. The goal is to provide laptops, tablets, and desktops to eligible organizations for your on-site or lending use. And we'll talk a little bit more about what that looks like here in a few slides. And then the biggest thing that folks, and we'll talk a lot more about too, is the projects to must advance the three priority areas, which is education, workforce development, and healthcare. And so all projects must demonstrate how access to devices will expand access in these three areas. So diving a little bit more into what our project areas look like. So as stated, we do have to make sure that there is a clear distinction between this education, workforce, and healthcare access. That does not mean that your proposed project has to specifically target all three areas. It just means that you need to be able to expand access. So what does that mean? So if you, as many of you are, you're focused in education, you might be providing devices for classrooms, libraries, or learning centers. And that might support virtual coursework, homework help, adult education, credential programs, etc. This connection builds digital literacy that carries into workforce training and healthcare use. So by allowing access to these devices, your focus may be education based, but it also provides folks the opportunity to further their careers or access telehealth in ways that they would not have before. A really good example I like to use is public libraries. They're providing access to these devices in these settings, folks can choose how they use the devices. They're not necessarily forcing a specific type of programming, but just by providing that access, they're providing that connection point for those three areas. So you do have to show how that access how this access will, sorry, let me rephrase this better. You will have to show that in your project, like by providing these devices, it will carry into these three areas, but it doesn't have to be like your central focus of your project. Similar to workforce development, by building digital confidence, this transfers into supporting children's learning and navigating healthcare tools. And then through the healthcare lens, confidence with telehealth also transfers to other online skills like education and remote work. So very high level, but just as folks are thinking about their applications, we need to make sure that that connection's there. We do have to disqualify any applications that don't show a connection between the three priority areas, which is why if you're kind of unsure what this looks like, it would be helpful to get your application in on Friday, which recognizing that's a tight timeline. So we'll talk a little bit more about what the application looks like here.
And Caitlin, before we move forward a little bit, just a reminder that since we do have interpretation, to speak a little bit slower, some of our languages take a little longer to say the same things in. So just hoping we can slow down a little bit for the rest of the presentation. But thank you so much, Caitlin.
Yeah, absolutely. Would it be helpful to pause here too?
Yeah, I think we can move on
Okay.
now, but just lower the speed a little bit and we'll be set up for success.
So organizations are required to deploy their devices through two core models. The first is going to be public computer stations. So these can be located in classrooms, libraries, career hubs, health centers, or other publicly accessible locations. And these are spaces that anybody can walk into, can use, um, and they provide consistent and reliable access. Others might decide to use a free to borrow lending program. So residents or community members can take devices home for education, work, or healthcare needs. You're able to define the loan period. So that can be for some a few weeks, months. Um, we leave that up to the individual organization to determine. Another model that some folks may choose to do, depending on your profession, is a more mobile lending program or more, sorry, computer lab. So if you're meeting with folks one-on-one in the community who don't have reliable transportation, you may be bringing them devices to meet their needs, but they may not be fully lending them. And we will accept this model as well. We just ask for folks to describe it in their application. So who is an eligible entity? Um, municipalities, state agencies, tribal nations, nonprofits, philanthropic foundations, educational providers, healthcare providers, community action agencies, career centers, libraries, as well as other organizations that can publicly deploy devices can all apply. Um, Applicants must be physically located in Massachusetts. We do say that they serve strictly residents in Massachusetts. If you decide to do a on-site computer lab and others from out of state come in to use it, that is fine. And then they must be made available to the public at no cost, again, through one of those two models. A question we have gotten a few times is around if you are a private provider or a for-profit provider, if you're eligible, and some things that we let applicants know to consider is if there is a membership fee, service fee, etc., to access your devices. If yes, then you're not public. But if you make the devices available for use or reservation to the general public, in addition to those you're serving, that would be eligible. If you also make the devices eligible through select hours and programming, that's also acceptable. Again, it just has to be made available at no cost. So if a fee is a prerequisite to accessing that device, unfortunately, that would not make you eligible. With these devices, since they are through, the funding is through the department, the US Department of Treasury, there is some contracting requirements that folks should be aware of. Um, with being awarded the devices, you will be required to attest that you will support access in those three areas. You will be making them available for public use or lending. These cannot be used for admin or internal use. If you're working, if your staff members check them out in their private capacity for, furthering education, workforce, and healthcare access, and they're members of your community, that is fine. They just can't be used for everyday like work use. Um, Devices will be deployed within 3 months of contract execution. And then folks will be asked to report any delays or unutilized equipment. We say that we may recapture devices. We don't necessarily want to do that. But if devices aren't being used, then we do reserve that right. Awardees will retain ownership through December 31st of 2026. That is what we call the period of performance that applicants will be required to report out on, which we'll talk about in the next slide. You're agreeing to no resale, transfer of disposal without MBI approval within that time period. And then you will maintain, support the devices to ensure public access. Also following Treasury CPF guidance, which is the Capital Projects Fund, and then maintain proof of purchase, which is really just the receipt that when devices are signed over, deployment logs, and service records. For reporting, folks will be required to report on a quarterly basis. So the first report would be due in June, or no, July, because the reporting period would be April through June. We have tried hard to keep the reporting requirements pretty light, so awardees will get access to a form. There'll be 5 core questions on the form. It'll ask how many individuals have used the devices, any risks or issues that you've encountered, a brief narrative, and then any projected plans. At the end of the program, folks will be asked to submit a program impact report. Again, just highlighting outcomes, challenges, and any success stories. That will be a little bit more comprehensive of everything that was tracked over the course of the 9 months, and will be provided a template to help fill that in. At the end, there will be a closeout package that we will also provide for folks to complete and then return, where you'll be confirming all serial numbers as well. A big piece to this is no administrative reimbursement will be provided. So we are providing devices to organizations. There is no exchange of money. So in other grant programs, funds will be distributed to cover admin costs. This grant program will provide the physical devices without the monetary exchange. So what equipment are we providing? This is also a good slide just to explain our role. So again, we'll purchase the devices and ancillary equipment that we'll talk about on the next slide. Devices will have productivity software as well as security software. We'll ship these directly to awardees at no cost. And then we'll work with you to oversee reporting. There will be no cost to awardees for any of the devices or software. And so this will be free to you. You'll assume ownership upon delivery. So again, we will transfer ownership to you, and those will be your devices. You'll have to keep them in public service through December 31st, 2026. And then complete quarterly reporting on devices and usage, as we kind of discussed in the other slide. So we have 5 devices that we're providing. The first is going to be our laptop, which is a Dell Pro 14. We also have a Chromebook available, as well as a tablet, which is the Dell Latitude, which is a 2-in-1 touch. There are also 2 types of desktops provided. These do come with a monitor, as well as wired mouse, keyboard, and headset. One is a standard, the other is a graphics desktop, which can be used for more advanced skills development, like graphic design, programming. Devices will come pre-installed with Microsoft Business. This is for the desktop and laptops only. The Chromebook and tablets won't have them downloaded. We'll also provide security software. Deep freeze is also available. This originally was for desktops only, but we've changed that since. For those unfamiliar with deep freeze, it essentially will wipe the computer after it's been rebooted. So if you have a computer in public use, every time you reset it, it will wipe the device. We also have 2 additional softwares that can be requested in addition to deep freeze. That's going to be our JAWS software, which specifically assists individuals with low vision or visual impairments. We also have TD Snap, which is a communication software for individuals who might be nonverbal and require additional support. Devices come with 3-year accidental damage protection, and those are for the laptops, tablets, and Chromebooks. We have a 2-year limited hardware warranty as well on all laptops, tablets, and desktops. The only device that does not have a 3-year accidental is the desktops. And then the Chromebooks have a 1-year limited hardware warranty versus a 2-year. We also are providing ancillary equipment, and this can be requested in addition to the core devices. We have charging carts to help keep the devices charged. We have docking stations, printers, a projector and whiteboard set, as well as a smart board. We also are providing remote patient monitoring kits, such as blood pressure monitors and glucose monitors. And we also have some additional assistive technology for individuals with disabilities. For individuals who are deploying devices on site, we also have network infrastructure equipment. In this section of the application, you won't request the device or equipment as you would everything else. We instead ask you to provide a narrative of your needs. If you have access to your floor plan, that is super helpful. We don't anticipate folks know exactly what type of equipment they need, and we'll work with you and our contractor to make sure you have the correct setup if awarded. So just to give an overview of the two device types. For our main device requests, you can request between 30 and 500. The software does not count towards your device minimum or maximum. So if you request 30 laptops and 30 subscriptions of Deep Freeze, still only 30. Final allocations are determined by your demonstrated capacity to manage devices and meet community needs. And so we do reserve the right to adjust final awards. Ancillary equipments are add-on to the main device, and they cannot be submitted on their own. And we do ask that ancillary requests are proportional to the main device requests. Moving into the application process. So the narrative is the core part of your application. In it, we ask you to describe your project in 5 key areas. Your scope and schedule. So we ask to provide a clear scope of the work and a timeline for device deployment. A justification for the number and type of devices you are requesting. Program alignment. So how will devices support education, workforce, and healthcare access? Public access. So how you plan to deploy the devices through on-site or a lending model. And then your strategy for measuring usage and providing ongoing support. If you request ancillary equipment, we ask that you also describe how the equipment supports and enhances the main devices and how it will be integrated with existing services to improve accessibility. We have a scoring rubric online as well. And in the application, questions are grouped by those 5 main areas that we're looking for. Additionally, there is helper text with 3 bullets. If you look and you answer those 3 bullets and you're clear and concise in what you're asking for, that is all you have to submit. There is no word count on the application, so you're free to use as many or as little words, so long as you're conveying what it is that you're trying to do. Applicants may apply through 2 different modalities. One is if an applicant would like to work as an umbrella entity. You can request up to 500 devices total. And this is helpful for organizations that want to apply collectively. So maybe you can't request 30 devices. You can only take 5 or 10, but there's a group of you that between you can take the minimum of 30 or more. One organization will apply as the lead and the others underneath them. We do ask that you include who those agencies are and their scope of work and how they will deploy devices. For example, one agency may want 50 laptops for after-school programming. Another wants 30 tablets for ESL classes. Devices will be shipped to one main contact for distribution, and then the umbrella organization will retain ownership of all devices and be responsible for reporting on behalf of all sites through the period of performance, which is December 31st, 2026. After that, the other entities may receive their devices. Individual sites will be treated as their own application. If you're looking for more than 500, this is where an umbrella organization may not be as effective. Each application must reflect the site's specific scope of work. We'll review those applications individually, even if part of the same network. We're fine if you work together to draft a collective grant template. If you are working together but would like to apply individually, you will not be dinged for having similar language in your application, so long as your scope of work and what you're looking to do is clearly described and unique to your organization. This is helpful for applicants who need assistance with deploying devices. We will provide that service. It is asked on the application what type of support you might need. So, and these will be directly shipped to your organization versus the umbrella organization. You will be solely responsible for receiving devices, ownership, and reporting. These two options provide flexibility. If you have a larger convening organization that wants to apply on your behalf, this would be helpful. If you're looking for at least 30 and want to only be responsible for yourself, you're also welcome to do that. The only ask is if you are an umbrella or an individual using similar language on your application, that you indicate that so we know that these are together.
And before we move on, Caitlin, I just wanted to call out too that I know we have some family childcare educators on today. So if you're operating family childcare and you might not want to request 30 laptops because you don't have a need for 30, but you want to get together in a group. I know a lot of our family childcare educators organize in Facebook groups or they organize in WhatsApp groups. Just want to call out that that might be a good place to pull together and do an application as a group in order to take advantage of the grant.
Yeah, thank you. So these are the categories that we discussed, and this is how applications are scored. I just want to make folks aware of this so they know what we're looking for, so you're not going into this blind. The full scoring rubric is on our website. So we're looking at project impact, feasibility and readiness, community engagement, equipped effectiveness, and then monitoring and evaluation. And this is where under each of these sections, you'll have 3 bullet points in the help text to help guide you to what we're looking for in responses. The total score is 100. We do have 20 bonus points for folks that are in gateway cities or designated rural communities, serving at least 75% of Treasury defined impacted households. If you're integrating digital skills training or lifeline support, I put ACP because that was formerly what we called the internet subsidy. Lifeline is a similar one, less broad. And then 5, we're committing to responsibly refurbish, donate, or recycle any existing devices. If you select this and are awarded, you will be expected to do that in your contract. If you don't have devices to refurbish, donate, or recycle, that's fine. For some of our bigger entities, we just want to make sure that those devices are being redistributed in the community. For ancillary, we're looking for similar pieces, again, connecting the ancillary back to the main use of your core devices. It might feel a little redundant. We're not asking you to come up with new responses, just connect your main application to your ancillary application. We do have 10 points for organizations that are federally qualified health centers, community health centers, or disability serving organizations. This is given due to the ancillary equipment that is required for individuals who are focusing on either healthcare or just general services to be able to effectively utilize devices. However, any agency is able to request any equipment on the ancillary. Again, you'll just be required to describe how that works within your programming. So what do folks need for applying? You do need a W-9. If you don't have one, we can send you one. You will need a UEI and TIN number. So your UEI is your unique employer identification. You get this through SAMS.gov. At this time, if you do not have a UEI number, you can still apply. We recognize with the government shutdown, this is delaying UEI numbers from being given out. So in your application, we just ask that you put, there's a number that I ask you to input in place of this. So we know that you've requested your UEI, but you're waiting on it. Please request your UEI prior to submitting your application. We'll work with you if this is a barrier and you're awarded, but you will need to make sure that you have submitted for it. And then we have the full application through our online platform submittable. So there is a help center if you get stuck with step-by-step guides and videos. But folks will either need, if you're not a returning user, you'll need to sign up and create a free submittable account. You'll complete the application form. You can go in and save drafts, so you don't have to do it all in one sitting. You can review the questions, come back to it. Once you're ready, you'll hit submit. Once you've submitted it, your application will be locked. If you do it on accident, we can reopen it. Just let us know, but please do so before the 31st. If you have issues with submittable, you will want to go through and contact the help center. If you're getting an error message, I have no way of fixing that. So I just want to make sure folks know that, to not wait on us to respond, to call their number or email them. And with that, I'm going to open it to questions. I know we talked about a lot, so if anyone is confused, I can break it down for you as well.
Well, thank you so much, Caitlin. We really appreciate you bringing all these resources to us and for the quick turnaround and getting a night session. I know there were some folks who reached out to us who couldn't attend last week's session during the day. So really appreciate you being here with us at night to make sure folks know about the opportunity. I know I saw a question in the chat, so I'll read it out. But for folks who have a question, you can raise your hand, we'll call on you, or you can drop it in the chat and I'll read it out for you. Our goal is to spend all these dollars and make sure they get in the hands of folks like yourselves who are going to use them. So Caitlin and I have talked to you about, like, it's better just to get the application off if you're thinking about doing it, and the team is trying to be as supportive as possible. But there is, some federal requirements with the grant as well as a very quick turnaround. So we hope that many of you can still take advantage of it. So if you have questions, raise your hand. Happy to call on you or pop them in the chat, and I'm happy to read them out. But I'll start with Loris's question with, what if I loaned out a laptop and it was never returned? Who's responsible for that?
Yeah, so we expect that to happen from time to time. You will be asked by the time you are implementing devices to have some type of policy typically you'll have some way of tracking individuals, whether that's they're currently in your system, there's currently a client. Similar libraries have different processes. We just ask that you report it to us. If it happens, it happens. We're just going to document it because it will impact your reporting. Now, if you are constantly having laptops never returned, that's another conversation we'll have with you first to understand what's happening. And then if we absolutely have to, which we want to do in the most rare circumstances, we may take those devices back if it seems like they can't be responsibly managed. However, our goal will be to work with you first before taking that step.
Caitlin. We'll go to Joanna and then I'll read Sam's question in the chat. Joanna, go ahead. Oh, you're muted. We can't hear you yet, sorry. Oops.
My apologies. Muted, of
There
course.
we go. Now we can hear you crystal clear.
So why we need technology training? So I represent Clarendon, a family child care system, and we have multiple sites, and I'm trying to just sort of operationalize how we might use this wonderful opportunity. But I'm a little sort of stuck on the whole telehealth piece, right? So we're early education, and I mean, I can think of a few different ways we might use these. But one might be, for example, each site has, 6 laptops and a charging station available to do tech training with educators twice a month or something. That's great, but it doesn't meet the requisites of this project, I think. So can you clarify that? I have a follow-up question too. That's okay.
Yeah. So, and I see another question about like, what does it mean to be publicly accessible, as well as how do you connect the two? These are intentionally pretty loosely defined. One, Treasury very loosely defined these. And so one thing we do ask is for folks to really, make the case for what it is that they're trying to do in their program in those areas. In regards to the telehealth, this is where, you can make the connection of, folks have busy schedules. They work hours in which it's not always easy to go to the doctors. So by providing device access, they might be able to take telehealth appointments through these devices. Or they're learning skills which help them manage their healthcare. We have so much of our society is digital, so you have to fill prescriptions online a lot of the times, or you go through your MyChart portal. We're not asking that you specialize in a specific area, but more so that you can describe how the skills or activities that you are providing by allowing access can connect to those 3 areas. I recognize it's a little tricky. That wasn't really forced upon us by Treasury. And so
No,
it's
I
really
get it. Yeah.
building that connection piece to what you're doing and how they connect.
Well, even if it's digital literacy and using technology as sort of the goal, then we could certainly connect telehealth. I think the other question, and maybe other people have it too, when you say public access, does that mean we have these devices in our offices? Does it have to be open to like the general public? That's a little scary, I think.
So when we say like publicly accessible, we recognize that some groups might specialize in certain demographics. The goal is to serve underserved communities. Like I think there's a question that I see that is, can tablets be used for children to use? They cannot specifically be used just for children. They would need to be made accessible to families, parents, to also use. So those could be, you're also using them for the children during the day, but then you're having, when parents come in to pick up their kids, they might be able to access the device and, do some, reserve them for, you know, whatever that might be. Or you might be running a digital literacy course. Unfortunately, they can't just be used for students. They have to be, broadly available in that sense. We ask for folks, this is not the question a lot of people want, but like to make the case for why you believe that your devices are publicly accessible to those that you're specifically serving. We take a lot of things into consideration when we're reviewing the applications. And I think, as Eugenia said, we really want to get these devices out to the community. So we're willing to hear where folks are going to use these and how they're going to provide access in these areas. So I know that's not as specific as what you might want. I really apologize for that.
Right. No,
Um,
I'm getting it, I think. But thank you. So I mean, I'm thinking there may be family childcare educators who need a device in their program for their business and so forth. And so, is it, would it be okay to loan out a device for the whole grant period?
Yes, you can
Okay.
define your terms for loaning. You just have to be able to report out on its usage. So, for example, somebody might decide that they're working with a client, they're going to give it out to them for the full year. The assumption is you're checking in with that client, you're still seeing them, you're talking to them, and you can report out on metrics and use.
Okay. And one more, I'm sorry, everybody, if you have a lot of questions.
No, I think it's helpful, Joanna, and to get some early childhood examples, especially in the family childcare space. So appreciate your questions.
Thank you. So what happens at the end? So let's say, we have these devices, we've been using them maybe in our sites or a combination, having some in individual family childcare programs. So the end of the grant period, what happens to the devices and the
Yeah.
ancillary supports?
Those are for you to keep. We will not take them back. There are some CFR requirements that do say that you'll keep them in your possession until December of 2031. So it's like 5 years after that 26 period. I will say that within that same CFR 200 rule, as long as you have an asset disposition policy, devices under 5,000, you get to decide when they have reached their usefulness.
Right.
So
right.
you're just required to keep them and report them out to us through 2026. That's where that treasury guidance comes. However, everything will be under $5,000. So if you can change how you would like to use them in terms of programming. So if you do decide after that point you want to use them strictly with students, you can. You're not bound by the CPF guidelines anymore. They're yours to use and yours to keep possession of.
Okay, I think I'm a little stuck on still the publicly accessible and what that means, but I'll think about it.
Are you, I guess maybe I can ask a follow-up. Are you publicly funded? Are you privately funded?
We're a private nonprofit, but we
Private,
have
nonprofit?
contracts with EEC.
But you are considered a nonprofit.
Yes.
Okay, so you're a public entity, so you're publicly funded. So again, that helps you make that case. You're not necessarily receiving like a for-profit purpose. It's a little bit easier for those that are publicly funded or a public entity versus those that are for like privately or for-profit.
Mhm.
So really making the case that the community you are serving, these devices are publicly accessible to them. And again, that's very broadly defined. So it could be, again, it's like during certain hours, you are making these available for these types of courses, right? We have some groups that are specifically going to use them for digital literacy training. and those are certain hours to the public. They might be serving certain demographics. They might be required to have certain income eligibility to access their programs to ensure that they're serving the demographics. They might specialize in serving groups that are disabled, right? It's not that they're not publicly accessible, it's that they are serving, specific populations of the community that would otherwise not have access to those devices. And so that's really what we are looking for in folks' responses is how are you serving your community specifically, right? Everyone's going to have a little bit of a different focus and spotlight, but how are you making those, accessible to those groups that you serve?
Oh, that helps. Thank you very much. Yeah, and I'm thinking parents as well in this whole mix, so just sort of have to sort it out. But thank you. I'm sorry to take up so much time, everyone.
No, appreciate. And I wanted to call out something too. I will say, like, I know almost every educator program that I visited is always going above and beyond to like support their community in different ways. So when you're thinking of like how to make things publicly accessible, I think all of you are helping families, all of you are supporting educators, whether it's, your neighbors or other people who have questions. So if you can think of those things and put them in, that might be responsive to the grant requirements. I think that the grants always feel extremely formal, but you're probably doing this work on a day-to-day basis. So thank you for your questions. Leah, if you want to go ahead.
I have a question because I am a family child care provider and I work with low income families who don't have access to the internet. Could I utilize one of these devices for them so that they have access for their child's homework, their child's doctor's appointments, or whatever it may be that they need to take care of their families?
Yes. Yeah, so that's completely fine. Again, we're just asking that you kind of justify to us why you are publicly accessed, right? Maybe you are the only like access point for them to get these devices, right? And therefore, they don't have another option. You're in a certain area where, there isn't a library for blocks. People rely on public transportation, like this is where I say we are very open to hearing, why your community needs these devices, why you're, making them publicly accessible and, reviewing your application in its entirety versus trying to slap on, kind of like this is, one way or the other. We get that a lot of folks, in your case too, you might be private, but you're still really serving those community members. So it does get a little bit tricky, but like I said, if you feel very passionately, you're like, I want to serve my community, I know they need it. Like if you're able to get an application in by the 31st, it helps us kind of review and try and see, what might we need to know more. And kind of like talk to you in that sense.
Okay, thank you.
Yeah.
Thank you, Leah. It's a great question. And I do think a lot of you can make a pretty good case for like how you support families and how having a laptop available might allow you to support families even more than what you're able to do now. So we hope to see some applications in there. All right, I'm gonna read some from the chat. I think we covered some of them in the back and forth, but I just want to make sure we didn't miss anything. But for others too, if you do have a question, raise your hand. And if you can't raise a digital hand, if you want to send me a message too, I'm happy to call on you, or you can throw it in the chat. But again, we had a question from Sam. If you work primarily with children and hope to apply to bring these devices into your program, how does this work with devices needing to be publicly accessible? So I think we mostly covered this one too. I think we got some great examples from Leah and Joanna. But Sam, if you need more clarification, feel free to let us know. And then we have someone asking, Ms. Grace asked, you can provide each family childcare program with tablets for them to use and the children enrolled to use it. I'm guessing this is asking again if you can distribute laptops to a number of family childcare programs.
Yes, you can. The only thing to be aware of is they cannot be strictly used for children. So you would need to make sure that they are available to families that you're also serving. So, that might be you're lending them out. They're accessible when families come in, and can sit, maybe reserve time to work on things while they're in your facility. I just got a message that asked if the devices will have Wi-Fi or they'll be Wi-Fi enabled. Unfortunately, that is not an eligible cost under the program. Um, to give, I guess, maybe a little context, the Capital Funds project was a lot of broadband infrastructure. So I guess in their eyes, that was already being established. So they will not come Wi-Fi enabled. However, they might be able to utilize the Lifeline program to access maybe a hotspot through that. So we have some resources if, to help get folks signed up, that I'm happy to share at any point. And so I would say, no, they do not come Wi-Fi enabled, but if you're serving somebody who's already receiving any type of like subsidy, like SNAP, LEAP, TANF, um, they receive a, voucher. Yeah.
Yes.
They should be eligible for Lifeline as well to support in that.
The next question I'm seeing, two questions from Beth Ann. Do you have to serve all three of the access points, or can you provide just like one or two? If you have a free teen after school program, can you use this program to supply laptops for the teens for homework help? This is a follow-up
Yeah.
question.
So you do not have to focus on all three access points. You just have to make the case why providing access enables all three areas. So if you're focusing, I forget who was it, who had just asked a question, I think it was Joanne. I used the telehealth example because that's what I'm most used to, but maybe it's learning to cook. It's like learning nutrition, recipes, like that's gonna, help support healthcare. You just have to make the case that what you're doing gives access to these different areas. We're having two specific info sessions. Again, that's the one on the 30th and the one on the 4th, to kind of help talk through more scenarios. We've been getting a lot of questions around this, and so we've been kind of like put our brains together of all the different types of providers, like what that could look like. And so we will be providing that, but um, you don't have to do programming in all three. In terms of the teen after school program, that's totally fine. Again, just making that connection that by providing this access and this programming, you're providing community members with the support to, further their education, further their healthcare goals, further job placement and training.
I think we got all the questions. Oh, I got another direct message. Just to clarify, I am a learning center, but we have multiple sites. Can I apply and spread the 30 devices between sites? If they apply individual, will we still share the 30 plus? I might need some clarification on the second question, Jennifer, but
I think I
okay, yeah, go ahead.
I think what you're asking is can they apply individually and collectively share the 30, or does one have to apply? So you just based on like contracting and working with vendors, 30 is the minimum we can ship out to a group. So you would need to have like one application, somebody is the lead, and then you can, yeah, indicate in the application 5 are going here, 5 are going here, 5 are going here. That's completely fine, but it would need to be under one application. You wouldn't be able to each individually apply for 5, unfortunately.
you interpreted correctly. Leah, did you have another question or is your hand up from before? Okay, no worries. I always leave that hand up. Um, but it looks like we got to all the questions. I did want to share too with folks. We are recording this session. We recorded it in all the languages we had interpretation for as well. So we'll be sending out the recording after the session, as well as the office hour links that I just put in the chat, the FAQ from the earlier info session, and the online form to submit an application. So we'll make sure to get those out to folks. And then again, there's a clarification in the chat that if you apply as an individual org, is the 30 computers the minimum, and that is a yes. So 30 is a minimum. So if you don't need 30, we do know that a lot of you are connected to each other in different groups, and maybe coming together as a collective would be a good way to put an application together, so that you could get the ones that you need, and then have maybe some others who can get, the other laptops, so you can hit that 30 minimum.
I will say too, and I think, Leah, kind of going to your piece too, if folks are also scratching their head where they're like, I feel like making the case for my agency is a stretch, I'm gonna put my email in the chat. We might know of libraries or other groups that are also kind of in a place where they can only request a certain amount, that's lower maybe than the 30. We have some municipalities that are going to apply that we may be able to connect you with and say, hey, this, place would really love to access devices and give them out to their families. Like, I would say reach out to me before just saying, no, I can't apply. Myself or Cheryl will do our best to try and connect you to someone. So maybe you're not the lead, but maybe you could be, kind of like a sub under them. I will say if we can try and do that, we're absolutely going to try and do that. So, I'm gonna say like, make sure that was right. Yeah, that's my email. So reach out to me if you feel like that is a barrier, and I will try to connect you the best I can.
And again, we are really grateful for Caitlin joining us at night to make sure this information is available. We do know that like this is a big grant application that was, written for like all sorts of different types of businesses, but we want to see childcare in the mix and getting access to computers and different technology. So we really do hope you apply. I think for me, the work that you all do is like a no-brainer for hitting those goals, providing access, helping people's educational pathways. And I know a lot of you are like sitting down with parents and showing them how to apply for things and different things like that. So we really hope to see those applications in. If you we'll send a follow-up email with some of the resources from today. But if you have questions, please don't hesitate to reach out to Caitlin or myself. We're happy to chat with you, and we'd rather see the application go up than a missed opportunity. So please consider submitting something. Again, if you get that early deadline of the end of the month, then Caitlin's team has an opportunity to review what you put in and share any questions or additional feedback that they might have to help you get a stronger application and be more likely to get an application that's successful. So big thank you to Caitlin and the team. Big thank you to our interpreters this evening. And a huge thank you to all of you for joining us after a long day working with kids and joining us for this evening. We really appreciate you taking the time and for all the work you do on a daily basis. Thank you all.
Thank you.
Bye, everybody. Have a wonderful evening.